Hello friends, welcome to my channel. If you are preparing for medical coding interview, then you are in right place. In this video, we will cover 10 questions you need to know for cracking your medical coding interview. So let's dive into 10 medical coding interviews with their answers. I will provide detailed explanation and examples to help you understand the concepts and boost your confidence. What is the difference between sign and symptom? So, sign is an objective indication of medical condition that can be observed or measured by a healthcare provider. And next, symptom is a subjective indication of a medical condition that is reported by the patient. So, sign is an objective indication that is measured by a healthcare provider, while symptom is a subjective indication that is reported by the patient. Fever is an example for sign. The healthcare provider can use a thermometer to measure the patient's body temperature, and it is recorded in the patient's medical record as a sign of underlying condition. So why the fever will come? The fever will come due to some underlying condition, due to some changes in our body. So it is a sign where the fever can be measured by a healthcare provider. Now we will see the example of symptom. Symptom example is pain, in which the symptom is experienced by the patient and it is reported to the doctor as, "Doctor, I have abdominal pain." So the doctor will investigate why the pain is coming and what is the underlying condition of that pain. So the symptom is experienced by the patient and reported to the doctor by the patient, while the sign is observed by the healthcare provider and it is measured by the healthcare provider. Next, what is the difference between axial skeleton and appendicular skeleton? The axial skeleton will include skull, vertebra and rib cage, while the appendicular skeleton includes bones, arms, legs, pelvis and shoulder girdle. Here, shoulder, arms, legs and pelvic girdle. So this is the difference between axial skeleton and appendicular skeleton. So this axial skeleton and appendicular skeleton is very much important in CPT coding of musculoskeletal system. Next, what are the 4 chambers of heart and their functions? So the 4 chambers of the heart are right atrium, right ventricle, left atrium, left ventricle. So what are its functions? Coming to functions, the right atrium receives deoxygenated blood from the body. The right atrium will be receiving the blood from the body, and the right ventricle will be pumping the deoxygenated blood to the lungs for oxygenation. After the blood enters the lungs, the blood will become oxygenated and that blood will be returning to the left atrium. So the left atrium will be receiving oxygenated blood from the lungs, and from left atrium it will go into left ventricle. The left ventricle will pump the oxygenated blood to the rest of the body. In body parts, the oxygenated blood will give up oxygen and take up the carbon dioxide and become deoxygenated. The deoxygenated blood will come to the right atrium. So like that the circle will be following: right atrium, right ventricle, left atrium, left ventricle. So these are the 4 chambers of the heart and its functions. Next, what is the difference between the respiratory and digestive system? So respiratory system is used for exchange of gases, carbon dioxide and oxygen. What is the function of digestive system? The digestive system is responsible for breaking down food and absorbing nutrients and providing energy to the body. What is ECMO? It is a very important question in the interview. What is ECMO? ECMO means extracorporeal membrane oxygenation. So what happens in ECMO? It is a medical treatment that provides temporary support to patients with severe heart and lung failure. So here is the diagram of ECMO. Here is the ECMO. So here the ECMO will consist of one pump and one oxygenator. So this ECMO is used in patients with heart and lung failure. So the heart is replaced by the pump. The heart function is replaced by the pump where the blood will be pumping, and the lung function is replaced by the oxygenator where the blood is oxygenated. Next question, what is the difference between an excludes one and an excludes two note? An excludes one note indicates that the condition excluded is not part of the condition represented by the code.
For example, I12 and I15-0. I12 is hypertensive chronic kidney disease and I15.0 is renovascular hypertension. This I15-0 renovascular hypertension is and excludes one condition for I12 hypertensive chronic kidney disease. So you should not code I15-0 along with I12 as these are in excludes one note.
This excludes to. Note indicates that the condition excluded is not part of the condition represented by the code, but a patient may have both conditions simultaneously. So here this excludes to indicates that the condition excluded is not part of the uh, condition that is represented by the code, but both can be present in the patient simultaneously. Here both cannot be present in the patient, here both can be present in the patient and can be coded simultaneously.
For example, I12 and N17. I12 hypertensive chronic kidney disease and N17 acute kidney failure can be coded together. Acute kidney failure N17 is in excludes 2 note for I12. So both conditions can be coded simultaneously.
So in what are the conditions present in the excludes 1 note cannot be coded together, and coming to excludes 2 note indicate that the both conditions mentioned in the note may coexist and can be coded together if supported by clinical evidence. Next, what is the seventh character in an ICD-10-CM code and how it is used? So the seventh character in an ICD-10-CM code is used to indicate the episode of care or the status of the condition being coded. So example S82.841A. This is the fracture code. This code, the seventh character A indicates the episode of care, which is, in this case is initial encounter. So here episode of care means initial encounter, subsequent encounter. What is this encounter? Whether it is initial or subsequent. The initial encounter refers to first visit of the patient for the treatment of the condition. So the seventh character in ICD-10-CM code is used to indicate the episode of care or the status of the condition being coded. Next, when do you use a separate procedure code? Answer is, a separate procedure code is used to describe procedures that are generally performed alone without other services or procedures. So these codes are used when the procedure is not typically performed as a part of larger procedure and they are identified in the CPT manual with a triangle symbol. So that's why it is known as separate, means it will be performed alone and it will be not performed with other services. So this procedure, laparoscopic procedure, is typically performed alone without other services or procedures. So therefore the CPT code 58661 is considered as a separate procedure and it is identified in the CPT manual with a triangle symbol. How do you assign a code for bilateral procedure? To code for a bilateral procedure, you should use a single code that describes the procedure being performed on both sides of the body, or you can use the modifier 50, bilateral modifier. This code is typically identified in the CPT manual with a bilateral descriptor. Example is 27395. First example is 27395. Lengthening of hamstring tendon, multiple tendons, bilateral. So here the code descriptor contains the bilateral word. So we should not use the further modifier 50, bilateral modifier. And second example is 29822. So what is the code description for 29822? The code description for 29822 is arthroscopy, shoulder, surgical, debridement limited one or two discrete structures. So here if the procedure is performing on two shoulders, in that code description there is no bilateral word. So we have to use the bilateral modifier as 50. So this is the bilateral procedure. To code a bilateral procedure, you should use a single code that describes the procedure being performed on both sides of the body, or we have to use the bilateral modifier. So these are the 10 medical coding interview questions. I hope you found this video helpful in your interview preparation. Don't forget to subscribe my channel for more valuable content on medical coding interviews and stay tuned for our next video. Thank you for watching.